All right. Hello, we are live. This is our first birth story podcast series. We're going to be interviewing a first-time mother who had a home birth. Some of the questions we'll be diving into are, how did you come to the decision to have a home birth? And how did you gain the confidence to go through it how did you gain the confidence to go through with it yourself? And what advice would you give to those who work in medical fields who question natural birth?
Yeah, and other questions that came up was, what did you wish to know before you had a home birth, and what helped you the most during labor? And is there something that you would love to try if you get pregnant again and you want to try to do a home birth again? So stick around because we're gonna dive into that. And so we're super excited, guys, that you guys are here. We are tuning in into Birth Workers Without Borders podcast, episode 5. Okay, I can't believe it. It's 5 now. And with your hostess, Stephanie. And so my pronouns are she and her. And I am a full spectrum doula, a women's health coach, emotional informed trauma consent coach, and a student midwife. And we are strong believers that families are free when they have full control of their health, their bodies, and babies.
Hi, and I'm Serena. My pronouns are she and her, and I'm a birth and postpartum doula, licensed massage therapist, birth photographer, and student midwife. And we created this podcast because we're passionate about educating our community throughout fertility, birth, postpartum, and parenthood. We're thrilled and honored to introduce our guest speaker today, who is 30 years old and an El Paso native. She's a registered nurse and has worked in the adult intensive care unit for 7 years. She has a 1-year-old son and is currently a stay-home mom. So let's welcome our guest, Cindy.
Hi.
Hi.
Nice to be here. I'm excited.
Yes. So, we're excited to know more about your birth story.
Yeah, thank you so much.
Yeah, of course. You want me to start, or?
The first question that I had was just how did you come up with that decision to have a home birth in the first place?
But have only had one successful pregnancy that went to have my son. So I had been thinking about getting pregnant for a very long time. So with that, I was doing a lot of research and just listening to podcasts, kind of seeing what our options were. But I never really thought outside of hospital. I mean, me and my husband are both medical professionals. He's a nurse practitioner and I'm a nurse. So I never really thought of having the baby outside of the hospital. But after the 2 miscarriages, I was just trying to figure out what to do. And I got connected with who ended up being my doula, which is Jamie Walker. And we met with her and she kind of discussed with us what our options were. And she was the one that really suggested having a home birth for the first time. And I remember my husband was very, very apprehensive all the way until the very end, until we had him. So I kind of just pushed to try. I said, let's just go meet the midwife. Let's see what she has to say. We asked a bunch of questions just so that we felt safe. And I think that's a misconception that a lot of people don't understand, is that it's not just this like random person that's going to go deliver your baby. Like there's a lot that goes into it. They're very well educated and they have their emergency kits in case anything were to, God forbid, go wrong with me or the baby. So after meeting our midwife, my husband was a lot more at ease. So we just decided to go through with it. And it was just something that I had researched a lot with the Informed Pregnancy podcast. I don't know if you guys have heard of that one with Dr. Berlin. And one of the things that really got me interested was that Hilary Duff spoke about her home birth. And that podcast was just, she seemed like it was some magical experience. And I said, oh, I want that. Like, I want to try not to have any medical intervention. And I think the place that would be most likely to succeed in not having any interventions would be at home. So that's kind of how we ended up deciding to do that.
Well, that's awesome. I mean, I know Jamie, and she's awesome. She really does promote home births, and I feel that's a really, at least knowing all your options is really important. You
Right.
know, because then you're able to understand what you want.
Right.
And what advice would you give to those that are in the medical field that hear your story?
So I think at first I kept it to myself a lot because when I mentioned it to like one person that I worked with, and she was very like, "Why are you doing that?" And pretty much saying like, "You've already lost two. Like, why would you risk not being in a hospital and something going wrong with this baby?" But I mean, I would just tell them, like what my husband says is that birth is crazy no matter where you are, right? It's an intense experience no matter where. I think it has a lot to do with where you as an individual feel comfortable. Obviously, like if you're not going to feel comfortable at home, if you're going to be very worried and very anxious the entire time that something's going to go wrong, maybe that home is not the place for you. You know, that's not where you should be. But then at the same time, if a hospital, and like I'm always at the hospital when I worked there for 7 years. So I kind of didn't want to be in that environment. But I would just tell them that do your research, you know, inform yourself, speak to a midwife, at least just to, like you said, to visit all your options and see if you feel comfortable, if you click, if you trust them, you know. And there, my midwife was Celia Busey. And she was just like, I mean, the cool thing about midwives is that I really like all my appointments took like an hour, and it was mostly just me talking to her and literally like asking her a million questions about, well, what if this happened? And what if this happened? And her just being like, you know, always having answers, which I think was part of what made us so confident is that she had an answer for everything. Like, because they're very prepared individuals. They're not just some random people that are doing this. You know what I mean? So I would just tell them to research, and that where you're most comfortable at. I mean, there's so many options where you can birth, and I don't think a misconception is that it's dangerous at home. And I think birth can be, I guess, dangerous anywhere. You know, either you're going to be rushed to an emergency C-section or whatever, anywhere. I mean, that's just what can happen. Things can happen no matter where you're at. So I think that would just be my advice to them.
Absolutely. It's like, you know, when everyone's talking to us, if it's home birth, birth center, hospital, or unassisted birth, it's like, yeah, anything could happen.
Right.
You know, like there was like, where is the most safe birth ever? And you know, there's always going to be something. But there's studies showing, you know, the benefits, you know, the difference between home birth and birth center and hospitals. That gives you the idea of like what will be better. But what you were saying earlier, when someone says, why are you doing that? Why are you risking if you already lost two babies? I want to kind of like just talk about that. Like, how did that make you feel? Like, to me, it somewhat makes me feel a little triggered. Like, how dare you trying to scare me because of your discomforts? You know, that's me.
No, I think someone, I don't know if it was Jamie, she told me just, you know, that to be very aware that people mean well, and they're they're coming from a caring place, but at the same time they might be attaching their own fears or their own experiences to your experience. And so I think I had that warning of like, don't really ask people, or someone told me, when you ask someone about their birth, tell them what was the best part about your birth. Because the first thing they're always going to tell you is like, it was long, it was horrible, or this happened. Like, we're more likely to tell people the bad things that happen instead of celebrating like the little victories that, hey, you know, this happened. And so someone had told me, just ask for the positives of someone's birth if you're going to ask, because a lot of people are going to be quick to put their own emotions and anxieties onto you. And you know, sometimes, and at that point I said, you know what, I am going to make myself in a little bubble and just keep, I didn't even tell my brothers that I was having a home birth until like until I had the baby, and they were like, oh, she had him at home. I just didn't want to hear, like, I wanted my little bubble of like that I was trying to create a positivity going into the labor to stay as positive as I can keep it.
Well, responding to you giving us advice about how to interview people about their births, can we just ask you that question right now? What was the what's the most beautiful part or most positive of your birth?
You know what? My birth was such a good experience. I think of it with nothing but like fondness. It was very hard, but it was magical. Like I don't know how else to, and I feel like people don't believe when I say that, but it really was just like a magical experience for me. It was a very like spiritual, like amazing. And I don't think there's like one single part where I could say like probably when he finally came out, and I have a recording of that, and it's crazy. I don't know who recorded it. It must have been Jamie when he comes out, and we didn't know the gender. It was a surprise gender for us. So when he came out, and I just said, "Hello, Yandel," and I just like got him, like I just identified him as like by his name already, and my husband, who had been super stressed the whole time, you could just see he was just like, finally, like it's done. You know what I mean? So I don't know. It was a magical experience. It was just amazing. I had a really good experience.
Yeah, that reminds me of, uh, when I had mine home birth. It
Mhm.
just makes you feel like, wow, yeah, it was intense. Yeah, there was some moments like, what the heck did I decided to do? Like, oh, like, like in my head, I'm like, what? It was like like, oh my gosh.
Yeah.
But once it ended, it was like, wow, I did it. He did it. We did it. I did it. It's like I could conquer anything. Like it just made me feel like I was this powerful woman. Like get on my way.
Right. Yeah. I totally like could. I felt the same way. It's amazing.
Yeah, I same. Same. I was really excited to like be renamed because that's like a thing, like just like you're literally a new person. So what's your new name almost, And it's like mother of your child is your name.
Oh, yeah. You're a new person.
Yes. And so, what did you wish after experiencing this magical experience? And I know you said it was a little bit, hard, but it's magical. Like you just knew you were gonna have, like you saw your baby, and you're like, oh, it's a boy, and you say his name. But what would you been like, man? Only if I knew this, or nothing popped up. Or
You know what? For me, it was more like postpartum. There was just some things that like I don't know if we just don't not I mean I know not everyone has the same experience, so maybe it's just things, or you forget that things, but like I had a really like bad like sacral like coccyx pain for like weeks, and so nobody ever told me that that was gonna happen. So I feel like maybe a little, I don't know, a warning probably would have done nothing, but at least to know that, hey, maybe for a few weeks like your bottom's gonna hurt, like to the point. And I mean, at that point, I was breastfeeding, and so a lot of your early motherhood is like sitting, and it was painful for me to sit for long periods of time. So I think that was kind of like well, I was not expecting that to happen. But as far as the labor itself, I pushed for a really long time, for like 4 hours and 10 minutes. So I had a friend that gave birth in January, and I had told her, she had asked me how long did I push, and I told her, and she said it helped her to know that because she never thought it could take that long, and so she had to push for a while too. And so she said it helped her to know that, like, hey, well, Cindy pushed for a really long time too. It's not like the end of the world, or the baby's not going to come out. Sometimes it just takes a while for them to come.
it's true. That's where it blows my mind in the hospitals because I know in the hospital at least say 3 hours.
Mm-hmm.
But when the mom is there and they're like, we're gonna practice push and the baby's coming out, they're like really rushing it. It's just like, what? Wait, she has 3 hours max, and you're trying to do everything within 30 minutes sometimes.
Yeah.
So it's crazy. But yeah, it's absolutely normal.
And there was a doctor here that I was a doula for, and he was so patient. And we all were like applauding him and thanking him because I think I'm like, he's younger and he was like, a male doctor. And it was the first time I had witnessed like somebody being like, yeah, this is over what's comfortable, but I believe in you, and like you can do this, and like we will still push, and we don't have to do anything else if you don't want to do anything else. It was really cool.
Yeah, that's awesome. I feel like that's probably rare in the hospital, but that's super cool.
Super rare.
Yeah.
It is, but that's awesome. But yeah, definitely postpartum, at least doing like a body work for you and the baby is not like you must, but it is something that you should at least try because everything gets flexible, your ligaments because of these hormones, and so everything is loose.
Right.
And so maybe the body remembers emotion. Maybe it was uh, we feel like, wow, this is beautiful, but there's moments in the labor that we might feel like, dang, this is really intense, and the body gets stuck that way. So maybe that's what you're experiencing, and doing like a body work or a Reiki or healing to help the energy, closing bones, to help the baby the body to know, hey, it's done. We finished this amazing marathon. Let's, relax or go back to center and alignment. And I think that's really helpful too after postpartum.
It would have been. I didn't do anything. I just kind of like toughed it out. But I wish I would have done, known about other options to do something for it.
Yeah.
That's what we do. I'm all like, is this going to be a commercial right now? No, but we do baby bonding, postpartum, even a year after. Closing bone ceremony is super important.
That's awesome.
Yeah.
Yeah, it's really beautiful. I love those ceremonies. They're just so magical too. Like it's just everything's so magical.
It is.
And did you have like during labor, even like no matter what different area, like early birth or after, was there like a mantra you're using, or what was helping you in those challenging moments to be like, no, I got this, or what really helped you in labor? I guess.
So I took a Hypnobabies course with Letty Knight, and she's really awesome. So I was listening to those tapes and then taking her classes with her. And I think, I have to attribute it to that, to being able to just kind of, and it sounds kind of weird sometimes when people, I don't know, like I feel like if you haven't gone through it, at least when I remember hearing people say things, you're kind of like, when they're like surrendering to just like, I mean, what am I going to do? Like, I'm already here. You know what I mean? Like, there's really, and I would tell people that like, you're already there. And at that point, you're just like, I mean, there's no way out but through. Like, you just have to go through it, And so that helped me a lot, just being able to kind of close off and go into my own self. And then during labor, so it was kind of I'll kind of go into my birth story a little bit, and so you guys can see what I mean. But so I had made a deal with my husband since he was still really anxious up to that point. So I had 2 different due dates, but we were sticking with February 17th as the due date. And so I was seeing an OBGYN as per my husband's request. So I was doing concurrent care. He never wanted to drop, because we didn't decide on a home birth until after the first trimester. So he didn't feel comfortable enough to drop that doctor. So, and nothing against that physician, nothing against her. I just said, well, we could go to the midwife and do everything with her, but he wasn't comfortable. So we stayed there, and they wanted to induce me. They had actually brought up inducing me at 37 weeks. And so I don't know what happened. I ended up like missing an appointment, or they never gave me an appointment. So then at like 38 weeks, they told me, okay, well, let's induce you at 39 weeks. And I kind of pushed back and I said, can you give me more time? And they had wanted me to get induced. So I gave birth on a Tuesday. They wanted me to get induced on Sunday, and I didn't show up. I was just like, I'm not gonna go. And so on that Monday, she called us, and they're coming from it's just different. So they called, and at first it was the office just calling me, and they were like, hey, you didn't go to your induction, like everything okay? Are you coming? Like you should come today. And I pretty much told them, you know what? I'm just gonna see if I can go into labor. And they kind of like, I heard them scrambling in the back, and then the doctor got on the phone, and they were like, pretty much like, we were driving to go eat with my parents, and they were telling us pretty much like, come, or you're risking that the baby, like you're gonna come and the baby's gonna be dead. And so I was kind of like, it takes like the breath out of you. You're kind of like, oh man, like you start to question, like, am I doing the right thing? And then of course my husband, who was already nervous, he just got more nervous. And so he's like, let's go right now. And I told him, just give me until tomorrow. Like if by tomorrow, like I'm not in labor, we'll go to the hospital. Like I'm not going to push you further than like, cause I felt bad, I didn't want to push him to like so far. I had already pushed him pretty far in his comfort level. So he was like, okay, whatever. So we went to go eat. And then all that day I had been having like mild cramps. And I remember my midwife and doula had come in the morning and checked the baby. And they were like, yeah, the heart rate's fine. Like everything's fine. So it's not like I had no peace of mind. I did. I mean, they had checked him and he was fine. And so I had told them about my cramping, but they were like, okay, well, I mean, just keep an eye on it. It doesn't seem to be like hurting you. Like you're just uncomfortable, like a little bit uncomfortable. So we went to go eat, and then came back home, and, my husband was a little bit upset because he wanted to go to the hospital. And so he got in bed. I took a shower, and then I got in bed like at 10:30 and my water broke. And then he was like, so are we going? Like, what's the plan? And I was like, no, I told you until tomorrow, and it started today. So we'll let the doula know, we'll let our midwife know, and like it's starting. And so what helped me a lot, I mean, at first it just felt like mild period cramps, even less, it was just kind of like, but then it started to get, I was bouncing on the ball, and then I tried to listen to the Hypnobabies track, but I had told Letty, like, after like her voice, I had already annoyed me prior to giving birth. I had always told her like, Letty, you should voice the tracks because this lady is like not cutting it. Like her voice is like, I don't know, I don't like it. And so I was trying to listen and I couldn't, like it was driving me nuts. It was like nails on a chalkboard, and I was like, I can't do this. So on it, what helped me a lot was I was listening to Billie Eilish, I don't know if you guys know her, but all her album, I would just listen to that one. And I remember on repeat, and it was super soothing. Like her voice was like really helping me through it. And like what helped me a lot was sitting on the toilet, which I guess it's common that kind of helps, which I never knew. But the position of like sitting on the toilet was the best. Like I would just sit there and like, okay. And then I had been texting Jamie and Celia, but I think they went to bed. And then Jamie was just kind of like, she checked on me like at 2 a.m, and she's like, hey, how's everything going? And I told her like, I don't know, I think it's getting like close. Like I was kind of at the point where it was getting like very painful, but I'm very like, the one thing that confused me the whole time is that when do you call or tell someone to come? Because it's like, when is it too early? When is it too late to call for them to come? And I mean, they don't live very close by. So it was a little bit of a drive. So I remember she was like, well, tell Chris to set up the pool, like, and then just let me know when you need backup. And I remember I told Chris like, hey, well, do you want Celia to set up the pool, or do you want to do it? I mean, Jamie to set up the pool, and he said, no, just call Jamie. So I called Jamie, and funny thing is that she was already in my driveway. She literally just rang the doorbell, and I was like, what are you doing here? And she's like, I had a feeling that you would be the type of person that called me when the baby was like already crowning. So I just came to just see how you were doing. And I was like, okay. So she came in and everything. And I was kind of like swaying. That helped too, just kind of swaying side to side. And and I was talking to her, and then I would just close my eyes and kind of just like this, and then open and like, okay, yeah, this is what you asked me, and then again. And she was like, I think we should call the midwife. Like, you seem to be a little further. Like, I think we should call her. And I said, yeah, sure. So they called her, and then she showed up like probably at about probably about 4, I think, or 3:30. They all showed up. And so it was Celia, and then she had a midwife student named Bernie. And then Jamie had a doula student with her. And then last minute, like literally last minute, Jamie was like, do you want me to call a photographer? Like, I have someone that can come. I really think you should do it. And we were like, okay. So then a photographer came as well. And so after, they were setting everything up, and it was fine. And then slowly it just started, I got in the water. That felt really good. But I quickly started to feel the urge to push. And obviously they just tell you, okay, well, whenever you feel ready, they're not checking you or anything like that. So I started pushing, and I was in the water for a long time, and it was like nothing was happening. And I turned I was kind of mean to everyone. Like, I would yell, and I was just like, what's happening? Because I felt like I was pushing forever, and I was just like, nothing's happening. Like, where's this baby? And they were just looking at, like, everybody was really calm and just kind of like, you're doing well. Like, you're doing good. The pushing's good. And I was just like, nothing's happening. Like, where is this baby, And they were like, no, well, like, your belly, it's already like low. Like, he's moving. There's cervical change. We can tell by the stuff that's coming out, the mucus and everything. And I was just like, mucus? Like, what? I don't care about that. Like, where's the baby? And so they moved me. They were like, let's move. Let's get you up. They're like, maybe you need to change positioning. And so I didn't want to. Like, I was just like, no. So we finally, like, they got me up. And that honestly was like the most, I guess because of the way I was lying, this is the only thing I can like think is that the baby was like this as well, laying back with me. And as soon as I stood up, I think this is what happened. Like, his head just like fell and like hit my cervix. And I was like, ah! Like, it was the craziest, like, you want to like collapse and fall. Like, I grabbed onto Bernie, and I was like, even she got like scared, because I literally like grabbed her. I just felt like, oh my gosh, like, why did you guys make me do that? And then they sat me on the toilet, and my husband, like, he thought it would be helpful to turn on the light, and I was like, like, turn off the light. Like, everything just seems so like, I don't know, like, you almost can't see that well, but you prefer like the darkness. And so when he turned on the light, I was like, what? And he turned it off right away, and they were checking the baby. And then they were like, okay, well, let's get back in the water. And I started pushing again, but like nothing was happening. And so eventually I heard them whispering. And then Jamie is like, hey, can Celia check you? Like, we just want to see if you might have what's called a cervical lip that's like blocking, that's not letting the baby come out. And so they kind of, the cool thing is that they explained to me, like, they took the time to tell me, like, hey, this is kind of what it is. Like, Celia's like, I think there might be like a piece of your cervix that's just not, just enough to keep the baby from coming out. And so she's like, can I check? And so she checked, and she's like, yeah, you have a cervical lip. Like, she's like, I can try to, I forgot what the word is, like, reduce it, I think. So she's like, it's gonna hurt. And I said, okay. I'm like, but whatever you think, if that's what needs to be done. And so she put her, and I don't know if you guys have ever met Celia, but she's like a very petite lady. And so her hands are like tiny. And man, when she like was reducing that, it was like so intense every time. And it was just like, wow. And she did it a few times until she's like, okay, that's like that's as much as I can do to move it. And so I pushed there a bit more, and then he wasn't coming. And I started to see the sun come up, and I was just like, what is going on? And so then they moved me again they got me up again, which I, didn't want to do because it was so painful, but they were like, you need to, like, you're like, something's going on, let's get you up. So they got me up. They sat me like in this donut like thing. And they sat me there. I did some pushing there. Nothing was happening. And then they decided to put me on the bed and kind of do more traditional pushes. And so I was pushing there. And I mean, I even got like poor Jamie, like into a chokehold. And like, I was so like, it was intense. Like I just, and at one point, like I yelled at everyone. Like I felt so bad because like the part of me was being rational, and then the other part of me was like completely in another like world. And so I remember I was like breathing, and the doula student I think she was just trying to help me. So she was like taking really deep breaths herself, like I think to remind me to breathe, but it was super annoying. And so I was like, stop breathing. And she was just like, she's like, oh my gosh, I'm sorry. And I felt horrible. Like I knew she wasn't like doing anything, but at that moment I was like, you need to stop like now. And then I had bitten my husband. And so they were like, no, like you can't be biting him. Like, and poor guy, he was like doing like, here, just bite me, it's okay. And they were putting like towels in my mouth. And then
Oh my gosh.
it was crazy. And then when I had Jamie here, because she was behind me on the bed and she was kind of just being support for when I would push. So I would like bring her head like that, like forward, like she was all like that. And I told her that for a brief, like I told her afterwards, like for a brief, like second, I was like, I need to bite her. Like I was gonna bite her face because I was just so like, I don't know. I just didn't know where to like put this energy, like this pain, like I needed to like let it out. And so we pushed there, and then, Jamie was also like, you could do it. That was a great push, like trying to encourage me. And I was like, Jamie, shut up. Like, just shut up. And so everybody got really quiet. And then Celia was in front of me, and then she's just looking at me, like very serious, looking there. And then I'm like, Celia, what's going on? Like, tell me what's going on. And she said, well, you told everyone to shut up. And I said, no, I told Jamie to shut up. You tell me what's going on. And so she told me like, well, like I could see, it looks like I could see some hair, like we're doing good. And so finally, like at one point my husband was like, Cindy, I think it's time. And then I was like, time for what? And he was like, well, it's already 9. And I said, and then what do you want? What do you want? And he's like, I'm like, you want me to go to the hospital? No, like I can't, like I'm like, it's not gonna happen. Like the same thing that's happening right here would be happening in the hospital. Like, no, we're not going. And so he walked out, and I'm like, even at that point, I don't even think I could have like gotten on a stretcher or gotten in a car. Like it was just already too far gone.
Mm-hmm.
Like literally after that. So another thing that kind of worried my husband is I did pass a little bit of meconium. And so Celia was like, hey, there was a little bit of meconium. She was like, it was really like tiny amount, and it was light colored, but the baby's like seems to be handling everything well. But I just wanted to, because that's one thing that Chris really wanted too, was to be informed the whole way of anything that is coming up. And the way they did it was just very calm. Like, no, she didn't have a sense of like it was worrying her or anything. It was just like, hey, this is what's going on. I just want to tell you guys, and I'm not worried right now, but just so you know, this is happening. So I think that kind of like made him like, he's already like an anxious guy, and that just made him more like, oh my gosh, what's happening? And so finally, I yelled at him like at 9 o'clock, and at 9:10, like I was at around like 9:05 or whatever, I pushed the head out. And it was amazing, like that push. Like, I know they say the ring of fire is like intense or whatever, but to me, like, it was the greatest feeling ever to just like finally, like I could feel myself like pushing him out, but it felt like yes, like finally after so much like work, like we have the head. That's awesome. So we got the head out, and then like literally like quickly, Celia, I just hear her say, he's stuck, we need a flipper. So they like, I was like, what are you talking about? And everybody just like literally she said it, and everybody just started pushing me over, and I was like, I was starting like to fight because I was like, why are you guys flipping me, you know? And then Jamie's like, just flip, like there's no questions right now, just flip. And I was like, okay, so I flipped on all fours and I birthed the rest of him, which was like the coolest feeling because it's just like I don't know, that's how it feels, just comes out. And
Totally.
so yeah, and then from there they were like, we were so happy, and you know, Chris was like, it's a boy, and then you know, we had our family time after that, and I called my mom and everything, and you know, was just crying because my mom had been trying to get a hold of us, but obviously nobody was answering, so she was freaking out. And so we told her like, you know, they're born, he's here. And after that, I did have like some, which is I think another thing, people I just don't know how prepared, you know, the midwives are, but I did like bleed, like I could feel like a bunch of gushing coming out. And Celia was just kind of, I could tell she was like thinking and maybe a little bit worried. And she said, you know what, you're bleeding a little more than I would like. So I think she gave me like a tincture. So I drank that. And then she gave me an injection in my thigh because I wouldn't stop, and she was just not comfortable with that. But I mean, one thing is like, I never panicked. I never was worried. I knew she had our backs. Like I knew that if something was wrong, like she was not the type that's gonna just like sit on it until it's like an emergency. So I think that's one thing people don't realize is that, and I mean, you guys would know because you guys are midwives, you're training to be midwives, that like you're like Letty had told me recently, like we're taught to like see yellow flags or whatever, like that's the flag we respond to. We're not taught to respond to a red flag. Like by the time it's a red flag, it's already too late. We're taught to respond to like, hey, it's not looking great, let's go get attend, like, you know, go to the hospital because we're seeing a yellow flag. And so I think that's important for people to know, is that they're not going to wait until they see a good midwife is not going to wait until it's a red flag. They're going to know like, hey, this is not looking good, we need to go. And so I never felt panicked. Out of all the like feelings I felt, I never felt that. And so what was cool is, I mean, they cleaned everything up, which is crazy. Like I never saw any of whatever mess I made. And Celia was like, you're one of the bloodiest births that I've ever I saw everything, it was all clean. I never saw what exactly they were talking. They washed my linens, like everything. And so yeah, I mean, it was awesome. I don't know. And then they're there with you for a little while afterwards. You know, Bernie was helping me like go to the bathroom and, you know, putting on like the diaper and all that, and kind of teaching me what I need to do for myself. And they weighed the baby. I mean, but they don't even rush any of that. Like I had the baby with me for a long time. And then finally she did her assessment on him and weighed him and, you know, took photos. But it's just so like if they have all the time in the world, like they're not gonna rip him away and like, I'll bring him back in 30. Like he was always with us. Like we saw the whole process, you know, when he got his vitamin K shot and everything, like was right with us. So it was, I think, like we started at like 10:30. My water had broken, and then I had him at 9:10 in the morning. So, but
Wow.
Yeah, that's awesome.
Wow. Thank you.
I mean, I think you had amazing team. You know, even having where Jamie had that intuitive feeling like, I should just go. You know, that's just amazing how intuitive she is. And that gives me chills. I'm like, oh, she has sixth sense. You know, kind of feeling, you know?
That's part of it too, is that you guys get to know your clients. Like it's not like a doctor that like you see for 5 minutes in an appointment and that's it. Like these people, like they, you know, you talk to them for like an hour, and you know, you keep in touch through text message like for your whole pregnancy or whenever you hire them. And so I think she got a vibe for my personality. Like she knew what I was like, and you know, they were very sensitive to my husband because they knew that, you know, we had discussed with them about how my husband felt, so they also knew that he wasn't exactly 100% on board. Like, I think even into the very end, he was hoping we'd end up in the hospital. Like, because I mean, he even asked me when my water broke, like, okay, we're going to the hospital. And I was like, no, like our bet was until tomorrow, and it's not tomorrow. So, so that it's just a different relationship that you develop with like an out of hospital like birthing team or doulas. Even if they're in hospital, they just know you more.
Yeah, exactly. That's where a doula becomes valuable because, there's different nurses and nurses have skills and all the different nurses are different. And some are very protocol based, right? And some are more like a little bit more intuitive or a little bit more caring. Some are super rushed. But from all those transition, your doula is still there.
Right.
Even in a hospital. But I mean, I'm happy to not you bit Jamie's face. So it's really good. I was just like, no!
I would have called you a pit bull if you had like bit me. I'm like, no, I'm lucky. I'm glad that like my rational side was like, no, you can't do that.
So I have a question. After your 7 years as a nurse and now this home birth and now a year with your baby boy, how have you reframed even like what it looks like doing your job again, or how it'll be different going back? Like, what are you thinking?
So I kind of want to get linked into some sort of like birthing role would be a goal of mine. I feel very passionate about it. I think it's something that is like a secret, like hidden gem in El Paso that not a lot of people know of. Like, you don't know about it until you search for it. And then you realize like, man, there's like, it's quite a bit of people that are into this. And so I don't know that I don't know yet. I mean, depending on, our financial situation at home and stuff, like, I don't know if I'll go back to work. I don't necessarily want to go back in that role. So I'm trying to figure out what I want to do in terms of like how to get plugged into like the birthing world and be involved in that way, because it's such a special experience that I just wish everyone would have. And because, you hear people that have had traumatic births and like just, choices stripped away from them. And, there is a time and place for things that if they really are like, you need intervention, then you need it. Like, there's sometimes you can't get around it, but also you hear of it and knowing how things are in the hospital and like having worked and being an experience, the things that like, I wasn't on an L&D floor, but even in my own floor, like, how the things are in the background and, and backstage kind of like what's going on. And so I could just imagine it similar, of things that, maybe a doctor will push a certain intervention, not necessarily because they need it to happen, but maybe, scheduling or time for their own thing that they're like, well, we need to do this. And so I think that's where it's kind of like a blurry, unless you find a really good doctor, which I hear that's kind of like what makes me sad though, because you hear about like California that has a lot of doctors that are willing to do concurrent care and step in only if they need to step in. Or you know what I mean? Or you'll have OBGYNs that will go visit a home birth just like if they need them to and just be like, oh yeah, like everything's going good. Or I think I heard of like a home birth where a doctor came, an OBGYN on that podcast that I listened to, and he came to their home and he like used the vacuum as an assistant because they had to. But it's like you wouldn't hear of that here. And I don't know why. Like, it's weird. So I don't know that I want to go back into that kind of role. And I thought of going back to like L&D, but then I just don't think with the red tape that the nurses have, even if I'm with my best intentions to go in and really help women have like the labor that they want, I don't know that the red tape would allow, or I'd probably, doctors wouldn't like me, or I'd have issues because they'd be like, hey, well, that's not how things are done here. And that's just that.
We were just talking about as doulas too, like when you're placed as an official doula in a hospital for doulas that do, or for hospitals that do have their own doulas, it's kind of like changes the role of a doula a little bit, because to some point, you're still now working for the hospital and you have to abide by what they say, where the doula is working for the client and helping them change that environment in the hospital, even if, there are people like pressuring them otherwise to change the culture they want in that room,
Right. Yeah. It's
So,
hard.
Absolutely. And in my strong opinion, I will even say for a fact, I believe that if you are birthing in a hospital and with no medication and you're moving and you're yelling and again, no, you stop in this, it will create panic to the practitioners and nurses because they are taught to control,
Mhm.
to calm things down. Like, we gotta settle this is too crazy versus actually like a nurse and a doula. Like, having Jamie or midwife, the assistant, them all going with that wave of emotions, those strong emotions that you're experiencing at that moment, and
Mhm.
allowing you to express yourself freely. And
Mhm.
they just know this is normal.
Yeah.
These strong emotions are normal.
That's literally like how you look
Versus,
at
yeah,
me. That's how they would look at me. Like it's like, oh, like they kind of like feel a little bad, but because they're just like, that's kind of just how we're gonna have to go through it.
yeah. And in a hospital, even like everything I'm learning about trauma informed and trauma and all these things, uh, they give pills, they give medicine, they give this, they scare, they like, here, do this because you can't handle it. Look at you right now, you can't handle it. And that could have like switch your mindset, like, oh, maybe I can't handle it, maybe I do medication, maybe I do need this. It just switches everything around versus actually allowing that wave um, to happen,
Mhm.
to go through with it. So I think it would have been a lot different. So
Yeah.
I'm excited that you're like, no, I'm not gonna go induced. Thank you. I'm gonna miss Sunday. You even did a bet with your husband. I think that's awesome. So I feel like you're an amazing warrior.
Yeah,
totally.
and that's one thing that Celia told me like afterwards is that in Jamie they kind of all were talking and they said that they think I would have ended up in a C-section just because of how long I pushed. And then, I had the cervical lip and then he had the shoulder stuck and like all of those things were just playing against me. And so they think that either the doctor wouldn't have had enough patience and would have just been like, hey, you've been pushing for too long. Like that's that. Or, if the shoulder thing, they would have noticed that. They would have just been like, either, because I didn't know. I mean, they told me that like either they break like my pelvis to get him out or they break his clavicle to get him out, and like he got out with nothing. Like we were both fine. I didn't even tear. I think I had a tiny, tiny tear that Celia was like, I can throw a stitch if you want, but it's going to heal alone. And so I was like, yeah, don't even touch me anymore. Like that's just leave me alone. So I think things would have ended up a lot different if I was in the hospital. And I mean, maybe like you said, I think nurses tend to want control of it. And I mean, I'm a nurse, so I know that like I could be controlling in my own environment because it's my environment and I'm gonna control. I mean, it's not mine, it's the patient's, but I take ownership of it as the nurse. And maybe that's wrong of us to do too, because it really is like a shared environment and more so impacting the patient than it is us. But we are a little controlling. So I could
Well,
see how they would
I
have
was
offered like meds or something.
yeah, that was kind of my question earlier of like what, how do you reframe going back to work or whatever, just being that you have this power, actually, like you have had this experience and you have a choice, really. Like when you go back into that environment, that is changing the culture now that you've experienced this, and like whether you're in the hospital as like maybe a doula, birth keeper, whatever you decide in your life, but being in birth is very sacred. And usually I do hear these stories of like whatever their job was, they had this amazing birth and that kind of becomes like their life in a way. Like after that, like I'm obsessed with trying to help people do this, so
Yeah.
thank you. I got chills the whole time and teared up a little, so thank you for
No,
sharing your story.
and honestly, like that kind of was like an epiphany right now, talking about like when you were talking about control, like how nurses want to control the environment. Like it kind of just clicked as I was saying it that like it's not my environment. it really isn't, because I'm not the sick one. I'm not the one, it's their environment and it should be treated with respect. But I mean, I think we just like want to control everything. So it's like, oh, in my line of work, it's a little different, but I would say that like a nurse sees, like you said, like sees someone yelling and then they're like, I got to fix that problem. Like it's a problem. So we need to like shut them up. And how you shut them up, like go in and be like, hey, are you sure you don't want the epidural? Like, you sure? And like, I mean, that's tempting, because when you're in that situation and it's so incredibly like intense, I could see why someone would be like, yeah, like give it to me now, because you're there. And so like, I think that was part of it too, that I felt like if I was in the hospital, it wouldn't have been successful in that way, because here I don't have that option. It's like, everybody's just kind of looking at me like, and at one point I was like, you guys don't know how I feel. And then Celia was like, actually, I do. Like, I've had a home birth. And I was like, ah! I was just like, no, you're right. But yeah, like, it helps that they've been through it, too. That also helps that they know, they're like, it's okay. Like, you're going to get through it. Like, it's going to end at some point. And that helped too, like to get through it. Like when you said what helped get you through it, was knowing that there was an end. There had to be an end at some point. And so it's not a pain that's going to last forever. It's going to end. And it's true what they say, like after you have the baby, like it's like, I mean, I did get up and I told my mom like never again, but like, but you don't feel like it ends. Like the pain just goes away, And so
Yeah, and that reminds me of where you're saying, the nurses and doctor want to control and want to fix it. And you're there as a nurse, and there's another nurse friend who was telling me, she's like, well, it's because sometimes we're dealing with individuals who don't know what they want. They don't want to know their options. So they tend to do this routine because I also say like, well, it's also the way the culture is, it's also the way that we're taught. Don't be a rebel because then you'll get punished. Don't voice your voice because you're a woman. You don't know enough. Like, it's little things as we're growing that is suppressing our voice. And so when people even give us the option, how do you want your care? And all they say, I don't know, I just don't want to feel this way. So nurses take that, I gotta control this, doctors have to control this, versus teaching them embodied voice consent, to understand, and that it's okay to dig a little bit more to understand that. I think that's really important, how all that also gets to that point of where you're at. And it's really sad that a doctor and then the office calls and say, hey, if you don't come in, this is what's going to happen, like scaring you. And then like you said, like, hey, you're at home, and you have to sometimes think like there's no hospital around. Like, I don't know, in my birth I was like, oh, so intense, and there's no hospital around here, so I just gotta just finish, like you just have to. And sometimes saying those words that might seem negative sometimes help, like I know that helped my mind. That was like, too bad you're stuck, so I don't know, I just, everything that you're saying, that's what I thought.
Yeah, no, and then in terms of like consent, I think that that's one thing that I was kind of shocked, because every time like Bernie would like come and like, can I check your baby? Like it was like, can I check the heart? Like, take the Doppler. Like she would always, before anyone like laid hands on me, it was always asking me like, is it okay if we do this? And I remember being like, they ask a lot, but they literally would ask for everything. Like even with the cervical lip, like, and I mean, like you said, it explaining things that literally took them 2 minutes to sit with me and be like, hey, like, this is what we think is happening. I would need to check to make sure that that's what to confirm that that's what it is. But even then she wasn't like, I'm gonna check you. She said, can I check you? Like, it was still my decision to, can she? And then when she confirmed that it was that, she's like, can I do this to try to help you? It was never something that she would never just like put her hands and was like, all right, let me see what's going on. Like never like that. And I feel like in the hospital, sometimes we just do things without even either explaining or asking. we just do it. And I mean, who wants to be like just touched by, like, especially in that sense, like that's a private area to just like be putting your hands inside, And so I think that I remember thinking like in my like days, like, man, they're always asking me like, can I? And I think it's because of that. Like, it's a consent, like, can I touch your body, or can I do this to you? And it does make you feel like cared for in that way, because they're taking the time to make sure it's okay with you.
Absolutely. Versus going, like, I've seen nurses who go, okay, so we're going to do a vaginal exam. And then I'm like, oh, are you comfortable with a vaginal exam? Like, I look at my client, and then the nurses are like, they pause, and then they look at her like, oh, yeah, would you like, like, that helps, right? And one thing that I just keep remembering what you're saying, you're like, I never panicked. I never felt worried, whatever obstacles, like you had little obstacles here. So, but I just knew my midwife, Sala was taking care of me. So that feels really awesome. Even all these obstacles with even all these strong emotions. And in the hospital, what are we trying to do is to feel care. So when a nurse comes and takes control, or the doctor, and says, hey, we're going to do this, we tend to go, okay, because all we want to do is feel safe. But there's different ways how to obtain to feel safe. And it's good to have, can I do this? Can I do that? Because you never know if that individual had trauma. And to ask is really important. So, I mean, those are all the little thoughts that are popping up with your story.
And I was going to add to that, if that's okay. Just, whether you're a doctor, a nurse, a doula, a birth keeper, a midwife, all of these roles, they can all be use consent. They all can, do things the right ways that we're all learning as the world is changing so quickly right now. Like we all, things like having pronouns or whatever, like all these different cultural things that are shifting, like every person in every profession can be picking up on this, or choose to stick with their ego, basically, choose to whatever makes it so that the power is a hierarchy and shifts it in the position of, what people usually respect more, instead of listening to the actual client or person there that is getting that care, and what do they think about their body and what's going on with them, and asking them questions instead of I'm the expert all the time. And I'm saying that because whether someone's a doula and a midwife, a lot of people sometimes assume, well, whatever they do is going to be better, and then you run into a situation where you had a traumatic birth with like somebody who claimed to be like very natural and different things. And so I guess the most important thing is connection, like connecting with who is you're getting your care from. We talked about that early, that birth team, creating the beautiful home birth team, creating the beautiful hospital birth team.
Right.
I also have another thing is that also, as like you're saying, all these practitioners' name, if we also understand there's always going to be a power dynamics in it, because I might not be a medical provider, but I took training, and for a client, it says, well, you're the expert, you know more. So like we sometimes tend to give that power, even if we're not trying to, because they're the experts. But if the experts, the providers, could always welcome no's, like, hey, this is what I like to do, you have this or this, it gives you the power as like, oh, I have a choice.
Yeah.
So
I'm pretty much like a very passive individual. So I remember I would tell Celia like, well, what do we do? And I think like with her, she never made a choice for me. She was like, these are the options. I can tell you about each one, like you said, but she was never like, do this. Like it was almost like I wanted her to tell me what to do, and she was like, I'm not going to tell you, like you pick. And even when I first met her, she was like, go talk to other midwives. She's like, it doesn't have to be me. Like, go see, what's out there and interview. And I think that's also like a good thing to tell people, is that if you are looking to birth like an alternative route, then research, like you were saying, is like make sure you have a good team, and it doesn't have to be the first midwife or the first doula that you meet. Like just make sure like, okay, get all your questions, meet several if you need to, until you feel like that connection and that level of comfort where you're like, okay, like this is the one that I want to choose,
Yes. Oh my gosh. Thank you for sharing. Thank you for sharing. Like, it's normal to have strong emotions. It's normal to be like your other side that we normally tend not to show. And,
To be an animal.
Yeah. I mean, I was wild. And then one thing, like in the Ina May book, I think it's like the Guide to Childbirth. I had read like some excerpts on it. And one thing that helped me a lot was like I don't know, in one of the stories, it talked about like a breathing technique where it's like, and that was like amazing. And I'm like, it sounds dumb and it feels dumb, but like well, first of all, like it feels dumb now, but when you're in that moment, like nothing feels dumb because you're just like, whatever, like I don't care anymore. But it was so helpful. And I had just read it like not that long before giving birth. And I was like, I'm going to try it. And I tried it. And it was like, wow, it was amazing for me.
Yeah.
We were laughing earlier, I think. Well, I was laughing about this, and I was watching Steph laugh when you were talking about hypno babies, because we both, I agree. Like, I've known about it for probably like 7 years now, and I was so excited when I heard about it because it was like the most popular option out there for hypnotherapy for birth. And then again, I put in those CDs, and it was just like, no. but I like the idea.
Yeah, like it's a good idea. Like saying some good stuff.
Even the music, I'm like, no.
I think it has to, like, when I do chemotherapy, but when I'm doing chemotherapy, I might have a script or not, or I adjust it, but I do my voice. Like people have to learn how to do their voice because you're interacting with that individual who's teaching you. And not only that, even music. Like this person goes, oh yeah, this music is awesome because I like it. Maybe it's soothing for her, but at the same time, knowing what music really relaxes you, and adding into that, like maybe the beat, maybe lower it down a little bit or something, because everyone's different. That what soothes them.
Yeah, and that's one thing that like with the hypno babies, because I think one of the rules is like you can't listen to music, or they don't recommend, like it's mostly just the tracks and like all the music in there. And I remember thinking like, oh man, like because I love listening to music, so I thought like the whole time I was like, oh man, like I can't listen to any music. Like I was kind of like, oh no. And so, I mean, I just kind of like, I couldn't deal with the lady. So I said, oh no, I'm just going to listen, what's going to comfort me at this moment and get me through this. Because it was different when Letty would read the scripts, because Letty has a pretty like calm voice. And I don't know, maybe it's also because like, I don't know, like maybe like it's comforting because Letty's like from here and like, you know what I mean? Like we all kind of have our own like accent, so maybe it just feels comfortable that it's like a familiar. I don't know, but I like when Letty would do it, I would like fall asleep and like when she would come to my house. But then when I would listen to that lady, like you said, I was like, man,
¿Qué es esto? Like, ¿qué es esto?
You're like, I wish I recorded Letty.
Yeah.
Yeah, Letty is amazing. I have a special place in my heart. She always gives you this like, oh, you're so awesome, and Jamie was probably the best doula for you because she also has this like toughness but very caring feeling. So for you to do this, almost biting her, I think she was a perfect doula.
Because she's very like she has a big personality, and like so I would say that might not be for everyone. You know what I mean? Like some people that have a big personality, just like her, it might be like clashing. Or if someone's like too like I would say Letty is not that she doesn't have a big personality, she's just more like quiet. And so if you're both like quiet, maybe you're not gonna bond because you're both just kind of like, and so I think it just depends on I'm more quiet. I would say that my personality is more like Letty. But I like Jamie's like a roaring lion, but that's like what I needed at my birth, is like for her to be there, because like I said, I'm a lot more of a passive person, so I needed her to like give me that confidence, like girl, like be loud, do whatever, like nobody cares, like just go. you know.
Mm-hmm. Yeah, so thank you very much. It's already an hour, and I think this was an amazing podcast.
Totally. We were so
Yeah.
excited. I was so excited. I was just like, how many times can I post about this? So thank you.
Thank you for having me. I mean, as you can tell, we could probably talk about this forever. So it was
Right.
fun.
Yeah. And if you know anyone else who wants to share birth stories, it doesn't have to be home birth. It could be birth center, it could be hospital, it could be unassisted, it could be in the car, whatever happened, you know, like, share that. Just
Well,
share
it
it
was
because
fun
I think it's awesome.
one of my coworkers at the time, she was pregnant as well, a little bit. She was due in April, so a little bit behind me. And I was kind of telling them my craziness about what I was gonna do, you know, craziness, and she actually had a home birth in April after me, and so she
Nice.
had the same birth team, and she did it.
Wow, cool.
It was cool to for us both to see her like working it out in her mind. You know, I was there because I would see her at work and like working out like, should I, like, what do you think? And you know, and me being like, it's up to you, like, go talk to these people and see what you think. And then for her to do it was awesome too. Yeah.
Mm-hmm.
That's awesome.
But yes. But thank you.
Of course.
Awesome. That was nice.
Thank you.
This is fun.
Yeah,
Thank you again for sharing your sacred story with us.
Thank you so much.